Hello guys, welcome to our channel The Surgery Times. Myself Dr. Aditya Prasad Padi. Follow us in Instagram, Telegram, Facebook as well as in YouTube, and also follow us in concert group of faculties. So today's topic is urinary catheters. We will detail discuss about the catheters types of catheterization and how to sterilize, the composition of the catheters, and there are uses like urological and non-urological uses of the urinary catheters and their complications. So in detail we will discuss about the urinary catheters in this video, whereas color coding of urinary catheter is in another video. Kindly look over that also. It is very important, and basically it is important for MS examination as well as MBBS university examinations. Along with that, nowadays in the NEET or AIMS entrance examination, you can face one question from this. So let's start the topic. So classification of urinary catheters, basically there are two types. One is non-self-retaining, one is self-retaining. Okay, after getting the catheter, you should describe it. What is the instrument? It is the two-way self-retaining Foley's catheter. Okay, like that you have to describe. So non-self-retaining means it will come out automatically. These are simple red rubber catheters, whereas self-retaining catheters are mainly Foley's catheter, which is most commonly used, and it is of two types, two-way and three-way. Okay, and others are Mallicot's catheter, DePager catheter, and Gibbon's catheter. We will see the pictures in the next slides. Type of catheterization: one is indwelling catheterization, other is intermittent catheterization. In indwelling catheterization, the catheter is left inside the bladder for few days, and it is achieved by either balloon tip catheter or flower tip catheter or strapping catheter. Okay, balloon tip is Foley's catheter, two-way or three-way. Flower tip is Mallicot's catheter or diffuser catheter. Strapping catheter is Gibbon's catheter. Okay, and intermittent catheterization is, you can see in the ward in the post-operative period, if there is retention of urine occurs, then in the post-operative day 1 or in the day 1, you can use the one used catheters, that is nail cats. Okay, just one sterile catheter you should insert through the urethra. Okay, and after the evacuation you should throw it out. So that is intermittent catheterization. Also in case of stricture urethra, you are using for that. Okay, now let's see the type of catheters. One is Indian rubber catheter, latex catheter, metallic catheter, polyethylene catheter, and gum elastic catheters. So Indian rubber is high sulfur containing catheters, red in color, heat resistant, whereas more irritant, so not used. Most commonly used is latex catheter because it is less irritant, can be kept for long time. Okay, soft and smooth. Whereas it can be sterilized by boiling autoclave or gamma radiation. It is important. Next is metallic catheter, can be male or female. We will discuss in the further slides. And used in difficult catheterization. Disadvantage is false passage. Okay, and next is to empty the bladder prior to vaginal hysterectomy. You should remember the uses. Polyethylene catheters, transparent and stiffer. Okay, now gum elastic catheter not used nowadays, and sterilized by boiling or autoclave is not done, whereas done by formalin vapor sterilization. Okay, and the composition are gum resins with cotton or silk impregnant. Okay, next is types: two-way Foley's catheter or three-way Foley's catheter, and it is basically used for bladder irrigation in BPS case, that is after TURP surgery. And silicone coated Foley's catheters are long term used for around 3 months. It is very important because it is less reactive and less irritant also. It can be kept for longer period. Now complications can be occur: infection, incrustation, bleeding, stone formation, blockage or false passage, stricture. Okay, all these are complications. Infection because it is connecting between a sterile into outside environment, so high chances of infection is also there. So once in difficulty in removal of the Foley's catheter, there are various ways to removal of difficult Foley's catheter. Okay, it is this slide is taken from recent journal article. It says cut the balloon port, okay, proximal to inflation valve, but it should not be done, or it should not be done because in case it also raises the difficulty level, but you should remember it is also a method. Okay, next is pass a wire through the inflation channel and now rupture the balloon. Next is pass central venous catheter over pre-placed guide wire. Okay, if still the balloon is not ruptured, then there are two ways. One is chemical way, one is puncture way. Okay, now what are the chemical you can use? Ether, most commonly used. Otherwise, mineral oils, most commonly available. Others are chloroform, acetone. Okay, next is puncture. It can be punctured through transurethral way or percutaneous or endoscopic. Okay, whereas ultrasonographic guided percutaneous puncture is done most commonly, and it can be done through transabdominal, transvaginal, transperineal or transrectal route. Remember, it is very, very important. Okay, the various ways of removal of difficulty Follis catheter. Already we have know the composition. Okay, it may be latex or silicone or metal. It is important. Sterilization already gamma radiation, or in case of metallic catheters, we can go for autoclave. Okay, so it is very, very important. French scale of measurement is used for this. Okay, and this indicates circumference. If it is given or written as 16 French, it indicates the circumference, okay, of the tube. And if for the diameter, we should divide it by 3, then it will come, okay, mm. It is the diameter. So suppose 24 French. 24 is the circumference, whereas 24 by 3 is equal to 8 mm is the diameter. Clear? So this is very, very important. Next is calibers of urinary tract. This is taken from Campbell only. Okay, remember this because the size may vary, so you should remember. So optimum catheter size initial attempt of bladder catheterization is 16 French. Always optimum catheter size is 16 French standard. Femal urethra size is 22 French. Okay, I have written in the smaller to greater way. Okay, so external meatus in male is 24 French. Penile urethra and bladder neck is 28 French, whereas prostatic urethra is 32 and bulbar urethra is 36. Okay, remember the sequence. Once it came in the recent NEET SS examination. Okay, so it is very, very important. Okay. Next is catheter associated urinary tract infection, that is CAUTI. Okay, it is defined as significant bacteriuria in a patient with symptom or signs indicating UTI. Either symptoms or signs of UTI should be there, like fever, burning micturition, itching, okay, all these things. Asymptomatic bacteriuria does not require antibiotic treatment. Asymptomatic bacteriuria is not required for antibiotic treatment. Okay, so universal recommendations in guidelines for preventing CAUTI are avoidance of catheter use. First is avoidance of catheter use. Next is maintenance of closed drainage system. Okay, and removal of catheter as soon as deemed possible. Okay, first is don't use catheter if not required. Okay, and as soon as possible you should remove the catheter. This is the main guideline or universal recommendation. Next is short-term antibiotic treatment, that is 5 days with catheter exchange has been proven equally effective as long-term treatment, that is 10 days antibiotics without catheter exchange in treating CAUTI. Okay, so better for short-term antibiotic treatment with catheter exchange as soon as possible. Okay, so these are the pictorial view of the various types of catheter. You can see this is the rubber catheter. Okay, simple rubber catheter. Number 10 means 10 French. Okay, and here it is already written in the tip. It is the open end, and this is the rounded tip. Okay, two ends. One is open end, one is the rounded tip, and here in the opening in the side wall is there. Okay, next is two-way Follis catheter, and this is the three-way Follis catheter. Okay, so three-way means this is the main channel. Okay, through this we can irrigate, okay, through this we can irrigate the bladder, and this one is for inflate the balloon as like two-way catheter. This is the main channel, and this part is for inflate the balloon. Balloon is present over here. Okay, now next, and this is the urobag. Next is use of simple rubber catheter. It is very important for a viva point of view, because many examiners you can come across that you are telling the uses of the catheter. It is a very easy also question and simple, you may think, but they can ask for more. Yes, tell another like that. Hence remember a few number of uses so that it will be easier for you. So first, whenever one examiner is asking uses of a Foley's catheter or simple rubber catheter, you should divide the uses into urological and non-urological uses. So first, urological uses are differentiate anuria and retention of urine by catheterization of the bladder, relieve retention of the urine, to collect the specimen of urine, okay, performing cystography, okay, for diagnosis of urinary tract injuries, okay, and also for administration of intravesical chemotherapy, that is BCG, in case of CA bladder. Okay, you should remember all the uses so that it will be a mark fetching for you. Okay, non-urological uses for diagnosis of the esophageal atresia. See, non-urological esophageal atresia in newborn. Okay, also you may be used as oxygen catheter. Also during choledocholithotomy, in order to flushing the bile duct with normal saline to remove the small stones or sludges. Okay, also it can be used during vagotomy, okay, by traction, applying traction over the esophagus in order to identify the vagus nerve. Okay, also it can be used to irrigate the abscess cavity. Okay, these are the non-urological uses. Now uses of the Foley's catheter, same almost. Okay, relief of the retention of urine first. Okay, next is suprapubic cystostomy, tube nephrostomy, urethral catheterization, most commonly used. Okay, either following urethroplasty or open prostatectomy for drainage of the bladder. Okay, already we have discussed that post URP we are using three-way Foley's catheter. Okay, now next is gastrostomy or jejunostomy tube or tube cecostomy, okay, cholecystostomy, all these things, as well as also for drainage of empyema or hemothorax or for pneumothorax cases. Okay, so remember the uses, it will be easier for you. Now next you can see the Malikott's catheter. This one is a Malikott's catheter, and this is the DePager's catheter. Already we have discussed, that is flower tip catheter. It is coming on under flower tip catheter. Okay, so first Malikott's catheter. Okay, how to change the suprapubic Malikott catheter? Suprapubic cystostomy catheter needs to be changed every 3 to 4 weeks. Okay, around 1 month. So local area is clean with antiseptic solution as like others. The catheter is removed by smart pull, just pull it. Okay, another catheter is introduced through the same tract by stretching the tip. See, by stretching the tip, it will become like a roller. Okay, the flower tip also become straighter, so that it will be easier to insert inside. Then again, it will revert back to the flower shape, so that it will act as a self-retaining catheter. Okay, now next is DePager's catheter. It is also self-retaining catheter, bulb at the end of which make it self-retaining. This person make it self-retaining, and same as Malikott catheter use, it cannot be passed for urethra because already obstruction is there. It cannot be passed through urethra. Okay, and usually 24 French size is used. Next is catheter introducer. Okay, prior to introducing the catheter, in case of mainly stricture, either stricture urethra or prostatic enlargement, these instruments are used. Otherwise, there is no role of this. Okay, and there is risk of false passage also in this technique, and may be used in order to introduce Malikott or DePager's catheter. Okay, and sterilization autoclaving. Already it is metallic. Okay, and these are rounded catheter introducer and Merrifield introducer. There are two types. Okay, Merrifield introducer, this one. Okay, this one is a rounded tip, already it is showing. Okay, because it can come as a image based question also. So this one is Diamond catheter. Okay, diamond catheter made up of PVC, polyvinyl chloride, with a beaked or stiff tip. See, the tip is stiff and curved. Okay, and it is also colored, and there is a handle is present in one side. So side holes are located proximal to the color course. There are slide holes. Okay, next is metallic catheter, female and male. This one is female, this one is male. You can see the male catheter, metallic catheter is quietly J-shaped, and whereas female metallic catheter is just curved or C-shaped. Okay, and female metallic catheter, you can see it is short, okay, shorter, and tip is rounded. Multiple side holes are present near the tip. Use before abdominopelvic surgeries, okay, to relieve the retention, easy. Okay, and sterilization is by autoclaving, whereas male catheter are also by sterilized by autoclaving, and these are long. Terminal part is curved, as I already said, it is quite J-shaped. Okay, tip is rounded, and there are side holes near the tip. Near the tip, there are side holes, and two rings near the base in order to holding the catheter. See here, there are two rings in order to holding the catheter. Okay, now procedure. How can you know the catheter has gone inside the bladder? Only one point you should remember: as the catheter goes into the bladder, there is loss of resistance. By this only you can feel that the tip is inside the bladder, and then after that you can adjust accordingly. Now the most common complication, also one of the complication, is paraphymosis. By after inserting the catheter, okay, we are forgetting to close the prepuce, means revert back the prepuce, okay, uh, by which there is edema in the prepuce occurs, and this is called as paraphymosis. Okay, it is the one of the complication after catheterization, so we should look over into it. Now our last type of catheter is Gibbon's catheter. Gibbon's catheter, you can see one strap is here, and inside the catheter is present. Okay, so this is in male, and this is a Gibbon catheter in female. Okay, this you can see the strap how it is used. Okay, so self-retaining catheter made up of plastic plus stellate, okay, in it, which makes the passage easier into the urethra. There are different sizes for male and female, and two ribbons are attached in order to fix by the adhesive plaster and less irritant to urethra. The main one advantage is the catheter along with a strap is present in Gibbon's catheter, okay, in order to fix it with a gum or adhesive plaster. So all types of catheters along with the sizes, and for color coding of sizes you can go through another video present and revise it 2 to 3 times and make a note, and also like, comment and share. And if you know any extra notes, then kindly put in the comment box. So see you with our new video. Till then, thank you and goodbye.